Morning everybody, I'm Kerri Douglas, I'm the ACP lead from Keele University. I appreciate some of you probably know me and see my face and remember your prescribing module and think, yeah, don't want to see that one again. And I'll let Vicky introduce herself.
So I've taken it from Kerri, so I'm the face that you're not going to want to see again in the future. And we've got some of our current almost completed students over there, and they're still smiling at us and waving. So yes, I've taken over as module lead for non-medical prescribing at Keele. Kerri's going to start the presentation.
Yeah. So we were going to give you an overview of the role and responsibilities of the DPP. We're aware that lots of you are prescribers in this room or very nearly prescribers. And obviously it's part of your responsibilities to support your colleagues going forward, isn't it? If you look at the RPS framework, there's a lot in there around supporting prescribing students going forward. So we're going to do a bit of an overview of the kind of role and responsibilities of the DPP, so you know when you are asked that question from a colleague in practice, can you support me, roughly what you're expecting and what you're going to be taking on. Because a lot of the queries that we get through are very much like, right, I've been asked, what's this going to take me in terms of time, what do I need to do? So hopefully this will answer some of those questions. Now, I appreciate that lots of people in the trust will be nurse prescribers, but there are also lots of other professions involved in prescribing. So there are a couple of different regulations that sit with prescribing and supervision of prescribing students, and ultimately what that often means is there are 1,000,001 different terms for the DPP or the assessor. So I'm just going to kind of cover a couple of those, just so everybody's clear on what that actually means and what you're being asked to do. We'll highlight some of the frameworks that you need to be aware of as a DPP in terms of supporting students, and we'll look at some of the challenges of the DPP role, because it's not always easy. It's all well and good when someone from your team says, will you support me, I want to do my prescribing module. Fabulous. And then they're terrible. And it's, well, what are you going to do about it? You know, it can be really, really difficult, can't it, to have those challenging conversations, particularly if it's somebody from your team who you know quite well, because you want to support your colleagues to get through, but it's about how can we support your colleagues in the best way and the most constructive way as well, and what we can do to help. Obviously, I'm speaking from a Keele perspective. One of the things to note is all universities will be working to relatively similar standards, because the prescribing module is so heavily regulated by the professional bodies and the RPS framework. So it's much of a muchness in terms of the requirements around supervision. One of the issues you may find is there's similarities within the documentation, but it's not exactly the same. And that's where your module leads from different programs can help you. So we're not here as an advert to Keele. All of this information will really transfer regardless of whether you're supporting a student from Keele or Staffs or wherever else it may be. So the designated prescribing practitioner, DPP, is an umbrella term, okay? And that basically is the person who is supervising and ultimately signing off a prescribing student. And you are signing off that student as being competent. There is a standardised competency framework, because what we were finding is the different professional bodies had different frameworks for what was needed for those supervising prescribing students. So what that means is if you're prescribing an NMC registrant, and then switching to prescribing a HCPC registrant, the terms, the requirements were all very, very different. So the RPS came together and put a DPP framework in place that is a bit of a cover-all, and it covers all of the requirements. So you're not having to wade through different professional bodies' guidance. If you are ever approached and you've not supervised a student before, the DPP framework is probably the best thing to look at to give you that clear idea of what you're going to need going forward. You should all be familiar with that framework if you are going to supervise, and importantly, you should all meet the criteria stipulated within that framework. So that's around the structure of education that you can offer to prescribing students, the standards that you're able to demonstrate to the students that you're actively prescribing, you're confident in your prescribing, and you're able to support students to find those other experiences as well, because it's not a one-size-fits-all with a DPP. Quite often you might work in quite a niche area or only prescribe for a certain area of practice. Most universities, Keele included, students will have to fulfil typically 90 hours. 45 of those hours must be completed with the DPP. That leaves 45 hours free. So if there's an area where you think the student really needs to develop in this area, but it's not an area that I particularly prescribe in, for example, or I don't typically come across these type of patients, that's a really good opportunity to use those other 45 hours to kind of facilitate learning in other areas. So it's about using the hours and not kind of doing that bit of an eye roll. I've got to support somebody and there's 90 hours and they're going to be following me around for a whole 90 hours, because that's not necessarily the case. So in terms of terminology, I've mentioned DPP, so that should cover all, that's your kind of title for anybody supporting and signing off and prescribing students in practice. Now if you're supporting an NMC registrant, they will need a practice assessor and a practice supervisor, and this sits within the standards for student supervision and education. So the NMC stipulate that any student who's an NMC registrant who's undergoing training requires both an assessor. The assessor is ultimately the DPP, the sign-off person, and they also require a supervisor to facilitate that student's learning. And the idea is that the assessor and supervisor kind of work together and come to decisions about whether that student's met the required standards. Now it's important to note, in those situations, the practice assessor is the one who must sign that student off, okay? So if you're quite new to supervising students and it's an NMC registrant and you're not quite sure about taking on that assessor role, sometimes taking on the supervisor role can be quite a nice introduction, because you've not necessarily got that responsibility of the sign-off, but you can get involved in facilitating and learning and developing prescribing students going forward. So some people often feel like taking on a prescribing supervisor role can be quite useful when they're getting going. NMC registrants also require an academic assessor. So essentially what the NMC wants is a tripartite agreement that students are meeting standards. So when students are on programme, typically the programme lead or a member of the programme team will be allocated as the academic assessor. And the idea is that the academic assessor, practice assessor, supervisor all agree that the students met the required standard. Now if you're supervising a HCPC registrant, you're often in a bit of a nicer position because they only need one person. So you've not got to worry about all of the different titles. So HCPC registrants only need what the HCPC term a practice educator, which is essentially the DPP. Now, certainly at Keele, and I know a lot of my colleagues at other universities, we do try and still support that tripartite approach. So whilst there's no professional standards that say that HCPC registrants require that final tripartite and the academic assessor involvement to sign off, we still do actively encourage that because we think there's an absolute value to those links between the university and practice areas, and ultimately making sure that students are progressing and progressing well. Okay, so as I've said, there is no kind of tripartite requirements that sit with the HCPC guidelines. The NMC do. Both professional bodies require a minimum hours standard, and both professional bodies require students to meet the requirements of the RPS framework. So any student on a prescribing programme must be able to demonstrate competence with the RPS framework in order to pass. And that is part of what is assessed in clinical practice by hopefully you guys as DPPs going forward, but also us as a university in relation to the assessments that we set for students. And say that hopefully if you're all prescribers you will be familiar with the RPS framework, but that is essentially what we're hoping that students are going to meet come the end of the programme. Students must meet every element of the RPS framework, and sometimes as a DPP you might have to think outside the box. So as I say, it might be thinking, well, students are not necessarily going to get exposure to antimicrobial resistance or consideration of prescribing antimicrobials in our area of practice. So that might be where you use those other 45 hours to facilitate learning in other ways, because part of the RPS framework is students need to understand clearly antimicrobial prescribing, and that doesn't necessarily sit in every practice area. So as a DPP, you are in that position to say, actually, let's arrange for you to go and spend time with this team for a couple of hours or this prescriber, and that can be really useful. I think, yes, I've remembered Vicky's slide quite well.
So I'm just going to clarify a lot of what Kerri said, because as you can tell, Kerri's lived, slept, and worked on non-medical prescribing for a number of years. So I'm going to just recap on what the programme requirements are. So as Kerri's already alluded to, the programme is aligned to the RPS framework along with the NMC and the HCPC requirements. And what the students are required to be assessed on ultimately is an OSCE, and 2 of our students over there have sat them this week. So that's a 30-minute assessment. The first part of the assessment is on history taking, then arriving at a safe prescribing decision, and then providing a safe prescription, which most of us in the room have probably been through. So as your role of DPPs is to facilitate students to be able to practice those skills over the 5 months. So allowing students to shadow you, taking histories, shadow other clinicians in taking histories, and then arriving at a safe prescribing decision, and then practicing writing the prescription. So for some students, when they're on the wards, they'll actually write the prescription, and then the prescriber checks it and signs it if it's correct. So those are the elements that we would want you to support students within clinical practice. Then the students have a pharmacology exam, which is an hour exam, and they need to achieve 80%. We're not trying to make pharmacists out of our students, so it really is the basics that they need to achieve. They've got a 17-point guidance of what they need to learn, and they also have script as well online, don't they, which I know some areas, clinical areas, they like their students to complete that. So they were delighted, so I've been told since I've taken over the module, that it was actually introduced into non-medical prescribing, and that was done by Kerri herself during COVID. So that numeracy exam, as I say, students have got 17 points, so if you could discuss those points with your students and have those conversations about pharmacokinetics, pharmacodynamics, remember that, ADME, just so the students can actually start to understand that in relation to the drugs that they're going to be prescribing in their own clinical area. Then there's the numeracy exam, and everyone's like, oh, we've got to get 100%. But it's not onerous, we do that online, and it really is basic maths in relation to drug calculations. So if you think about writing a prescription and linking it to that, it's saying, well, I'm going to prescribe this drug for these amount of days, so how many tablets do I need, or those basic skills, and students get practice of that online, okay? And then there's the assignment, which is a 3,000 word assignment, and that's based on the legal, professional and ethical concepts related to non-medical prescribing. So having those conversations about controlled drugs, about responsibilities, about ethics within your area is really important, and will help the students to develop their assignment brief, meet their assignment brief. And then there's the competency document that Kerri's talked about that needs to be signed off by yourselves, which is where you're more involved really. There are 10 outcomes, but within those outcomes there are quite a lot of areas that are required to be signed off. So this is where it may feel a little bit onerous on yourselves. So students are required to have an initial interview with their DPP, and that's where you agree learning outcomes and learning areas, and then arrange for your student to go out to different areas if they need to gain that experience. As Kerri said, if prescribing antimicrobials isn't what they're going to be doing in their clinical area, but they want to expand on that knowledge, then you getting them the opportunity, or getting the student the opportunity, and you giving them the time, releasing them to go and work in other clinical areas would be great. Then you've got your intermediate interview. where you check where you are with your students, see if you actually, are there any barriers to learning and what plan you can put in place for them to get over those barriers, to achieve those outcomes. And then there's the final sign-off. And as the DPP, you are required to complete the final sign-off. So it's not the PS for NMC students, it must be their practice assessor. And as Kerri said, all HEIs work to the same standards, however the approach may vary. So that's basically meaning all the standards are based on the RPS framework, but other universities might actually, the paperwork might look different, that's basically what it means, but the actual learning outcomes will be the same. So, requirements of the DPP, just as a recap, working in partnership with the academic assessor and the PS if applicable. So the practice supervisor, as I've just said, is for NMC students only. You're also required to raise any concerns. So initially, one would hope, as you would with anything in practice, that you'd raise it with the student first, and then if required, that you would escalate those concerns to the academic assessor. The academic assessor's name, details and contact numbers are in that practice assessment document. So it's very much working together with the student and the university, and we're very flexible, aren't we, Kerri? We'll meet with you, yeah. The clinical hours, as Kerri said, the minimum is 45 hours with the practice assessor. That's for NMC students, and for HCP students, they have to do the same, don't they, with their practice educator, that's right. The other 45 hours is used to try and get out and get further experience in other clinical areas if possible. Take responsibility for coordinated students' learning, yeah, but also the student must take responsibility themselves. Meet with the student, as I said, for their initial, interim and endpoint meetings, and for the tripartite meeting. So the tripartite meeting that Kerri spoke about earlier is where you meet with the PA, the student and the academic assessor, and that's generally Kerri or I. And assessing a sign off the competencies, as I've mentioned. And then really it's just looking about approaches to assessment. So there is a comment box in the practice assessment document. One of the questions I get very often is how much do I need to write in there? So basically, you as a clinician are signing this off. And you can write just observation, direct observation, discussion, reflection. You don't have to be working alongside and observing every single outcome. Back to Kerri. Thank you.
Just to say off the back of what Vicky said, just to offer anybody assurances who's thinking about maybe taking up the DPP role but a little bit unsure, there is training offered, so anybody who signs up as a DPP for one of our students, we do send out training. We used to do face-to-face training, but in all honesty, uptake is quite poor, and we understand why. Everybody's busy in practice, you're all stretched. So we therefore changed it to e-learning, and we use an e-learning model that covers all of the standards. So essentially it wouldn't matter if you supervised a student from Keele or Staffs or Wolverhampton or wherever they come from, you're only having to do one set of e-learning, and there's opportunities to do like annual updates if you've not supervised a student for a while. So there's no expectation that you go all the way back and start again. We do also accompany that with a DPP handbook that's available to anybody supporting students, that kind of essentially reiterates a lot of the training, but also picks up on some of the elements that may be slightly different from Keele. So for example, that practice competency document, just so you don't feel like you're trying to kind of wade through working out the Keele paperwork as well as supporting your students. So do be assured that there is that support there. For DPPs, and likewise, as Vicky's already said, we are absolutely there to support you. So if you do take on that role of DPP, do feel free to get in touch with us, and we're happy to guide you and support you when you're supporting your students going forward. I think it's important because we're not here to sell you the DPP role, okay? Generally speaking, most people who've been through this process want to help future colleagues, don't they? So we're not here to sell you this role, but we're trying to say, actually, it's not that bad once you're familiar with it. But we also recognise that it can be an absolute nightmare as well. And I'm not gonna lie about that. You know, you're busy in practice, you've got your own clinics, you've got your own wards to see to, you've got your own ward rounds, whatever else is going on. And then you suddenly remembering, I've got a prescribing student who's either happily following me around, or I've got to find something for them to do, they've got to learn as well. So we appreciate it's challenging. I think particularly in the current climate where winter pressures are now just pressures, aren't they? You know, there's no getting away from the pressure that people are facing, and it can be hard. So we just want to recognise some of the potential challenges you can face as well, and say time and service demands are the biggest issues that people face. Whilst we absolutely want our students to get through, and we want them to get through in a timely manner, what we also recognise is that it's not always possible, okay? So if your ward's had 10 staff go off sick, and you're the only prescriber, and you're also trying to supervise the students, and you physically don't have time to get those hours in, the best thing you can do is speak to us, because we'll always try and facilitate perhaps a little bit more time, for example, for the students. It's not ideal, it's not what we want to do, but what we don't want to happen is assessments are being rushed and hours with supervisors or DPPs aren't meaningful, and essentially students aren't learning because they're literally just chasing their DPP round who's running around like a headless chicken. We would much rather have a conversation and say, well, actually, would it be better for us to give another month for this document to come in and these hours to be achieved, in which case we will be assured, and you will be assured as DPPs, that that prescribing students had a meaningful experience. So we're always happy and open to have those conversations, okay? I've already alluded to like areas of your own knowledge and learning needs. So you might look at the competencies and think, so I use antimicrobials as an example, but there might be others where you're thinking, hang on a minute, I'm not necessarily the most up to date in this area, and that's where you can utilise your other 45 hours and link your students with other practice areas, other prescribers, pharmacists are the student's best friend on these modules, aren't they? Because that's where you get your pharmacology knowledge, okay? Often terrifies people, but usually the pharmacist is your best friend, and when you're a prescriber as well. I think that work-life balance can be difficult because not only are you running round, then your students saying, by the way, this competency document needs signing, you know, this huge thing that's 95 pages, well, and then you end up taking it home. So that can be really challenging, and again, we'd always prefer you raise these concerns to us because we'll try and facilitate and support where we can. I think recognising knowledge gaps for students can be a bit of a challenge as well, because you may have worked with somebody for quite a long time and they may be an absolutely fantastic nurse, AHP, but actually when it comes to that step up to prescribing, there's quite significant gaps in their knowledge. So you've got to kind of try and find out where those gaps are and try and help the learners to plug their gaps, be that with doing additional reading, be that with spending time with other prescribers, spending time with other teams. And those can be quite challenging conversations, can't they? Particularly if it's somebody you've known for a long time, and suddenly you're thinking, hang on, these people don't know as much as I thought they did. I need to perhaps have some discussions around here, but that can be quite difficult. And I think your own confidence can then start to be affected as well. So the best thing to do when you're supporting students in practice is to give the feedback in action. So it's no good spending a whole month working with somebody. You get to the end of the month, you sit down and have a coffee in the office and you say, right, can you remember the second day we were together? Didn't like what you did with that patient. It's pointless, isn't it? Because the chances are they've forgotten. The best thing to do is actually give that feedback in the moment, or as close to as possible. So that might be having a debriefing session later on. And it can be quite difficult to kind of have the confidence to have those discussions and conversations, particularly when it's with colleagues, to say, actually, you know what, that wasn't necessarily the best approach. What we'd usually say is, well, that wasn't the best approach. Have you thought about doing it this way? And always you're trying to get the student thinking, aren't you, about how they could improve, rather than just saying, look, that was absolutely terrible. What are you going to do about it? And it's always useful to go, I won't tell you what we call it, but essentially, nice little bit of feedback, give them the rubbish, and then give them a bit of something nice to end on. Because otherwise, what you're going to end up is with students who think, my DPP just thinks I can't do anything right. They just keep saying to me, I've done this wrong, well, that wasn't right, or I need to do it this way. Whereas if you can throw those positive bits in as well, because there's always something positive, even if that's just, you know what, you were really nice to that patient. It might be that the history was terrible, and that's your kind of middle bit. So that's your learning point to take on, but it can be really difficult to do. And I think as much as we pretend as practitioners, we're often people pleasers, aren't we? And we don't want to give feedback. My first 6 months working at Keele, I was terrified of failing a student. Absolutely terrified, because we don't want to give that negative feedback. But ultimately what we have to remember is, obviously, we're wanting students to come out of the back end of this module as safe and competent prescribers. They are not coming and doing a module that they're just going to tuck on their CV and never use. They're going to be out there prescribing, aren't they? We want to make sure they're doing it properly. And if that means we have to have challenging conversations, then that's what we do. If that means students have to fail, then unfortunately that's what has to happen. But it is quite difficult to do that. I think the key thing is, if you've got concerns, raise them early, okay? So what can sometimes happen, and what we sometimes see in the university, is students will come to us a week before their documents are due for submission and say, my DPP's just said I'm not going to pass this. And it's like, oh right, okay, well what's gone on in the interim? You know, has there been any conversations? And there's been nothing. And often there's been concerns that have been rumbling, but nothing's been raised. So raise it as early as you can. Ask the students what their views are, because students may actually think that they're not performing as well as they could be. They might think they're doing amazingly, but ask them, you never know. Make sure you're constructive. So I've already spoken about your nice bit of feedback, your absolute rubbish, and then your nice bit of feedback again. So be constructive. If you feel attacked, you're less likely to want to respond, are you, in a positive way to getting feedback. So make it constructive. Also, make suggestions. So it's not just you're terrible at this, it's how can they actually improve on that then? What does that person need to do? Do they need to do some more reading? Do they need to develop their skills, their knowledge in another area? And that is key. And it can also be useful to use things like SMART to look at workable goals. So it's not going, you've got to go from here to here. One, you've got no idea what you're doing and you've got to go all the way through to being competent. How can you break that down? So, you know, in the next couple of weeks, I want to be able to see you carry out a consultation that's well structured. And then they achieve that, and then you add a bit, and so on and so forth. Don't just say, right, you're not doing it at all, and we need you to be at this level, because often students, particularly with the pressure of this module anyway, you know, most of you have been there and know the assignment level and the assessment level that sits with it. It can be very overwhelming if they feel that nothing is going right. So break it down for people. And I've mentioned this a couple of times, but ultimately if there are any concerns, let us know. So as academic assessors, we are always here to support you. We're always happy to have conversations. The first person, as Vicky said, you should raise any concerns with is the student. We would always encourage DPPs to contact the academic assessor as well. The earlier we have these conversations, the earlier we can put measures in place to support students, okay? Be that, do we need to look at exceptional circumstances processes? Do we need to allow people more time to achieve their competencies? Do we need to put an action plan in place? Is it a student who's just not getting it? Does that student have significant personal issues going on, they need to take a break? Whatever it may be, we will absolutely try and support you. Students have 2 years from start to completion of this module, okay? And that's set by the professional frameworks. If a student starts and they're failing and we don't know, the risk is they will fail their assessments, then they'll do their resits, they'll fail them. And before you know it, they're timing out on their 2 years. Whereas if we know there are issues early on, we can try and put measures in place to prevent that from happening and prevent that from going on for the full 2 years. So we will do what we can to support. But the key thing to remember is any evidence of unsafe practice, that student must absolutely fail, okay? So whilst it can feel uncomfortable to not sign somebody off as passed or not sign a particular competence off, ultimately, as I've said, these people are going to be prescribing for patients in the very near future if you're signing them off as competent. If you are not happy, it absolutely should be a fail. But we would absolutely hope before you hit that stage, we've hopefully got something in place to support that student going forward. And always use, I think we say this in the health service anyway, always use the friends and family test. So would you want them prescribing for your relative, your nan, your mum, your dad, your brother, your sister, whoever? We use it in assessments. So obviously we've got very strict assessments, but one of the questions we always say, and we'll say it when we moderate, would you want them prescribing for you? And if your answer's no, that's your answer as to whether they should pass or not, isn't it, ultimately? But say, it can be really, really difficult, and we do appreciate that. And we're always, always happy to support, but as I've said and as I've mentioned anyway, if you're not happy, don't sign the student off. Some suggestions are that the GROW model is quite useful in providing students with support. Essentially, it's basically smart actions. So I always say the most simplistic way, rather than having to learn another model and think about how to give feedback, is just use smart actions. If you feel somebody needs to continue to develop, set some smart action plans with them. Let them know how they can achieve and how they should be attempting to achieve, so what they need to do to help them get there. But say ultimately, if you're not happy, don't sign, but please do contact us and we'll always do what we can from our side to support you. And that's it from us. If there's any questions, please feel free. Otherwise, if there's nothing, but you end up with it, supporting a student in the future, please do email us and we're happy to support you or go over anything you may need.